So in this class we are going to see details of abdominal aorta with its ventral branches. So the aorta, as we know, it is arising from the upper border of heart as arch of aorta. Then after it is descending posterior in the thoracic cavity as descending thoracic aorta. Later it is going to pass through the aortic opening of diaphragm, which is a muscular partition seen between the thoracic cavity and the abdominal cavity. And in this diaphragm part we will be having an opening called aortic opening. So through that opening we will be having this entrance of descending aorta, which is reaching the abdominal part. So we are calling that as abdominal aorta. So this abdominal aorta, it will reach in the lower part, that is at the level of L4 vertebra. So the extent, if you are taking the abdominal aorta, it is extending from T12 vertebral level to the L4 vertebral level, where it will divide into two branches. So those two branches are called as terminal branches, which we will call as left common iliac artery, and then we will be having right common iliac artery. And this abdominal aorta on the whole, the vertical course will be around 10 to 12 cm in its length. And now we are going to deal only about the details of three important branches which are arising from the ventral aspect of abdominal aorta. So to deal with the details, so see, now we are going to focus the major arteries coming from the anterior aspect of abdominal aorta. So as we know, this is the abdominal aorta. Here, the ventrally we have three branches arising. One we will call as celiac trunk. So this artery is called as celiac trunk. Then after we will be having next artery, just below that we will call as superior mesenteric artery. Celiac trunk will be at the level of L2. As soon as the abdominal aorta is descending below the diaphragm, we will be having the origin of this celiac trunk. One level below, that is one vertebral level below, at the L1 level, we will be having the origin of superior mesenteric artery. Later, at the level of L3 vertebral level, we will be having another artery arising. We will call that as inferior mesenteric artery. So these are the three important branches which are arising from the anterior aspect of abdominal aorta. So now we will see details of each artery separately. Talking about celiac trunk, so as we can make out, it is just a small part, you can see. So it is just about 1.25 cm in length. Later it will divide into three important branches. One is going towards the left side, which is tortuous in its course. We will call that as splenic artery, as this will end up in spleen. So we are calling this as splenic artery. Later we will be having another artery, which is a first artery to arise from celiac trunk. We will call as left gastric artery. This is also winding and going towards the left side. So celiac trunk, it is giving two branches towards the left side. One is splenic artery and another one is left gastric artery. On the right side, we will be having one artery arising from the celiac trunk. We will call that as common hepatic artery. So these are the three important branches coming out from the celiac trunk, and about the branches of these things we will deal later. Now we will move on to superior mesenteric artery. This superior mesenteric artery, again, it will be having a long course, and in this course it will be having a concavity towards the right side and convexity towards the left side. We can make out that. So this is the concavity of the superior mesenteric artery, and this is the this is convexity towards the left side, and from the convex part of the superior mesenteric artery, we will be having many jejunal and ileal branches arising. You can make out many branches, small branches which are arising from the convex side. We will be calling that as jejunal and ileal branches below. So these are the jejunal and ileal branches of superior mesenteric artery which are arising from the left margin of the superior mesenteric artery, which will be 12 to 15 in number. Now, if we see this right margin, which is concave, here we will be having three important branches arising. So we will be having first branch called as inferior pancreatico-duodenal artery. So we'll be having first branch as inferior pancreatico-duodenal, and below that we will be having middle colic artery, and then below that we will be having right colic artery, and below one we will call as iliocolic artery. So on the right side we will be having 4 branches. One is inferior pancreaticoduodenal, then we will be having middle colic, and then we will be having right colic, and later iliocolic artery. So these will anastomose with each other by means ascending and descending branches, which I will explain you in a diagrammatic representation. After celiac trunk and superior mesenteric, we have one more artery which is arising from the ventral aspect. We will call that as inferior mesenteric artery. This inferior mesenteric artery, it is giving branches such as we will be having left colic artery, and then we will be having some sigmoid branches, and later we will be having superior rectal artery, which is a continuation of inferior mesenteric artery, which will go downwards. So these are the major arteries which are arising from the ventral aspect of abdominal aorta. Now we will deal about each artery separately with its branches and how it's getting anastomosis with other branches and getting supply or giving supply to organs present in the abdominal part, and how it is going to supply, forming the anastomotic, any specific pattern of its anastomosis. All those details we will deal now.
So in today's topic we are going to deal with an artery, the major vessel seen in the abdominal region, that is abdominal aorta. So while explaining an artery, we have got some important things to deal with, such as from where it is taking its origin, and second thing, where it is getting terminated or getting ended up. So origin and termination we are going to see. Along with that, those arteries which are passing to the particular region will be giving some important branches, and where these branches are getting supply. So these things are the major parts we are going to get in explanation of an artery. So in today's topic we are going to deal with abdominal aorta. Aorta, as you already know, it is an important vessel in our human body which is having its origin in the thoracic region, and then it is extending downwards in the abdominal part, and in the abdominal part, the part of aorta we are calling as abdominal aorta, and in the pelvic, just above the pelvic region, it is going to terminate by dividing into 2 important branches. So first we will get to see the origin of this abdominal aorta. So the origin, it is nothing but a continuation of descending thoracic aorta. So as you know already, we have got a muscle in the middle part between the thorax and abdomen region. So imagine we have got a muscular region in the body which is dividing the thoracic cavity above. So we have got above thorax and below abdomen, and those two are divided by means of a muscular partition, and this muscular partition is nothing but diaphragm. So this is the diaphragm part which is dividing the 2 cavities of our body, that is thoracic cavity and abdominal cavity. And the artery which we are dealing as aorta, which is having its origin in the thoracic cavity, such as we have got heart present in the thoracic cavity, and from the heart we have got an important artery arising, that is aorta, and this aorta in thoracic region has divided into ascending arch of aorta and descending thoracic aorta. So 3 parts of aorta are divided in the thoracic region. Then after, by piercing the diaphragm, the muscle, it is getting entered in the abdomen part. So after piercing the diaphragm, it is called in the abdominal region as abdominal aorta. So this is the artery which we are going to deal now. So this whole artery we are calling as abdominal aorta. So this is descending thoracic aorta which is present in the thorax, and this is ascending thoracic aorta, and this is arch of aorta. So about these things we will deal in the thoracic region. Now we are concerned about abdominal aorta which is seen in the abdominal region. So origin, you know, it is a continuation of descending thoracic aorta. So this descending thoracic aorta piercing the diaphragm going to get continued as abdominal aorta. and termination, this abdominal aorta is getting divided into two important branches on the right and left side, and these two branches are named as iliac artery. So near to the ilium bone it is getting divided, so it is called as iliac artery. So we are calling this as again right iliac artery and left iliac artery. So this is left iliac artery and this one is right iliac artery. So this is the termination of this abdominal aorta. So origin and termination, I think people are clear. Descending thoracic aorta continuing as abdominal aorta, which is terminating by dividing into two important branches, right and left iliac artery. Now we are going to deal about the extent of this particular aorta. Extent in the sense from where it is starting and what are the surface landmarks related to it, to understand a better way of where it is found. So extent, if you are seeing, it is present opposite, that is the starting point here. This starting and ending we are going to see for the extent of abdominal aorta, and it is first in the origin point, it is seen opposite the lower border of T12 vertebra. So you know we have got posterior aspect with vertebrae. So we have got 7 cervical vertebra, 12 thoracic vertebra, 5 lumbar vertebra and 1 sacral vertebra, which is having 5 sacral vertebrae fused together, and then we have got coccygeal vertebra. Now we have got T12 thoracic vertebra seen in the abdominal region till the L4 vertebra. So we have got this as an extent. So the extent of this descending thoracic aorta, abdominal aorta is starting from lower border of T12 thoracic vertebra. So from here it will be having its extent starting, and then it is getting extended till the body of L4 lumbar vertebra. So this is thoracic vertebra's last vertebra, and we have got remaining vertebrae present where all this are getting related, that such as L1 and L2 and L3, and it is extending the artery which we are talking is abdominal aorta, extending from lower border of T12 thoracic vertebra to the L4 vertebrae opposite the body of it. So this is considered as extent of the abdominal aorta. I think it is clear. So behind this abdominal aorta we have got the back region where we have got vertebral column, and these are the vertebrae where it is getting related. Now talking about the length of this abdominal aorta, the length is extending from 12 to L4 vertebra, which will be around 10 to 11 centimeter. So length to 11 centimeter will be the length, and if you are talking about the breadth, it will be 2 centimeter. So breadth of the artery is 2 centimeter, length is 10 to 11 centimeter. So that's all about the general concept of abdominal aorta. Now we will get to see what are the structures, other structures related to this abdominal aorta, such as front, behind and on the right and left side of this particular artery. So talking about the relations. So we are going to deal about relations of this abdominal aorta now. So we are going to deal this relations under 4 subheadings. So relations of abdominal aorta we are going to deal. So such as we are going to divide this into 4 categories, that is in front or anterior aspect of the abdominal aorta, behind and on right and left. So these are the areas where we are going to see the relations of this abdominal aorta. So first we will move on to front relation. So relation in front of the abdominal aorta, how it is related we are going to see now. So in front, first we have got, as you know, abdominal aorta. So we are going to deal with front relation. So we are showing aorta in dotted lines, which will be seen behind the structures which we are going to see. So abdominal aorta is present behind. In front of this, we have got three important arteries arising, such as we have got celiac trunk. Just below that, we have got another artery called superior mesenteric artery, and below that we have got another artery called inferior mesenteric artery. These three are branches of abdominal aorta which is coming from front of its part or anterior aspect of the abdominal aorta. As you already know, behind we have got vertebra. So the celiac trunk, it is arising at the level of T12, and superior mesenteric artery, it is arising at the level of L1, and inferior mesenteric artery, it is arising at the level of L4. So this is how it is getting origin, and now we are going to see how the names of the arteries. So this is celiac trunk, and this is superior mesenteric artery, and this is inferior mesenteric artery. So these are the three important structures arising in the front of abdominal aorta. Along with this, we have got some more structures related to it, such as we have got some nerve plexus surrounding the celiac trunk. So surrounding the celiac trunk, we have got some plexus of nerves surrounding it, and that plexus is also related anterior aspect, and we are calling that plexus which is surrounding the celiac artery. So we are calling that as celiac plexus. Celiac plexus. And related to superior mesenteric artery, above the superior mesenteric artery, we have got a vein. So we have got a vein above the superior mesenteric artery, and below also we have got another vein related, and that vein is called as renal vein. We have got left renal vein related below the superior mesenteric artery. So we have got two structures related above and below the superior mesenteric. One is splenic vein, and another one is left renal vein. So these are the two more structures related above and below the superior mesenteric artery. Now we are getting to see inferior mesenteric artery. So this is the third branch arising from the abdominal aorta in the anterior aspect. Here we have got, just in front of it, we have got duodenal part. In duodenum we have got four parts. Among that, the third part of duodenum is going to pass like this. So this is third part of duodenum. So third part of duodenum also will be related. Third part of duodenum. And then one more structure which is also related is, this is superior mesenteric artery. Just above the superior mesenteric artery, we will be having body of pancreas related. So this is body of pancreas related just above the superior mesenteric artery. So body of pancreas. So these are the structures related in front of the abdominal aorta. So relations of abdominal aorta, we are seeing abdominal aorta. So in that front relation, we have got these many structures. We will get to see how many are there. Celiac trunk first, then celiac plexus surrounding it, and then we have got superior mesenteric artery. Related to that, above we have got splenic vein, and below we have got left renal vein, and above that we have got body of pancreas, and just below that we have got inferior mesenteric artery, which is again in front of that related to third part of duodenum. So altogether we have got 8 structures related in front of the abdominal aorta. Now we will move on to posterior aspect of abdominal aorta relation. So behind relation we are going to see. So related behind the abdominal aorta, what are the structures we are going to see. So as we know, posteriorly we have got vertebrae, that is 4 lumbar vertebrae are related. So we have got abdominal aorta, And behind the abdominal aorta, we have got vertebrae such as L1 vertebra, L2 vertebra, L3 vertebra and L4 vertebra. So we have got L1, L2, L3 and L4 vertebra are the four vertebral relations seen in behind the abdominal aorta, and along with this we have got some arteries arising behind the abdominal aorta, so that also will be related along with this, such as we have got four pair of lumbar arteries arising from it, four pairs on either side. We have got lumbar arteries. So such a way we have got four pairs of lumbar arteries. So four pair of lumbar arteries and four lumbar vertebra. Along with that we have got one artery arising from the posterior aspect midline, that is median sacral artery. And these are the structures related behind. Along with that, on left side we will be having a small part of a muscle called left psoas major muscle. We have got left psoas major muscle also related. I will repeat the structures present behind the abdominal aorta, such as lumbar vertebrae. So first relation is lumbar vertebra, which we already know, that is L1, L2, L3 and L4 vertebra. And behind the abdominal aorta we have got four pair of lumbar arteries arising, that is four pair of lumbar arteries. And then we have got one midline artery arising, that is median sacral artery. And then we have got one more structure, that is here we have got a dotted muscle outline, and this is nothing but left psoas major muscle. So these are the four structures related behind the abdominal aorta. First is lumbar vertebra, lumbar arteries and median sacral artery and left psoas major muscle. So these are the relations seen behind the abdominal aorta. Now we will get to see the structures seen in the right and left side of this abdominal aorta. So in right side we are going to see on right side. So now we are going to see the relations on the right side of abdominal aorta. So we are getting to see all the relations of abdominal aorta. We have seen about front and behind relation. So on the right side we have got other relations such as on side of abdominal aorta. So you have to imagine the structures which we are going to deal. Whatever structure we are telling, all those structures you have to have an imaginary idea of how it is related to the particular thing we are talking. So talking about abdominal aorta again. So this abdominal aorta, consider this as right side. So always this will be right hand area and this will be left area. On the right side we have got three important structures related, such as we have got an important vein related just right to the abdominal aorta, that is nothing but inferior vena cava. So this is abdominal aorta, as you know, abdominal aorta. So this abdominal aorta, on the left side it have got an important structure called inferior vena cava, and then we have got another lymphatic vessel, that is thoracic duct related to the abdominal aorta. So this is thoracic duct related on the right side of the abdominal aorta, along with a muscle part. Some few muscle fibers will be related on the right side, such as we have got left crus of diaphragm. So we have got abdominal aorta. On the right side we are dealing. So in the right side of the abdominal aorta we have got three important structures related, such as we have got an important vein on the right side, that is inferior vena cava, along with an lymphatic vessel which we will call as thoracic duct. So on the right side relation we are talking. So we have got thoracic duct related on the right side of margin of abdominal aorta. Along with that, we have got some muscle fibers of the diaphragm which is present above, giving its or having its origin by few muscle fibers arising from vertebra, and that is nothing but right crus of diaphragm. So right crus of diaphragm is the another structure related to the right side of abdominal aorta. So we have got first structure as inferior vena cava, second structure as thoracic duct, and third structure as right crus of diaphragm. So these are the three important structures related right side to the abdominal aorta. Now we will get to see the relation on the left side. On left side of abdominal aorta, what are the structures seen? So we have got abdominal aorta again. So this is the left side. In left side we have got again one more lymphatic vessel related, that is nothing but left lymphatic duct. So we have got left lymphatic duct related. Along with that, a duodenojejunal junction also will be seen over here. So we have got first one such as left. So this is on the left side. So in left side we have got left lymphatic duct. So right side we have got lymphatic duct, that is thoracic duct. On the left side we have got left lymphatic duct, and this is duodenojejunal flexion. So duodenum, it is going to continue as jejunum, and that point we will call as duodenojejunal flexion, which is also related to the left side of abdominal aorta. Along with that, some muscle fibers for the diaphragm, that is nothing but left crus of diaphragm. Crus of diaphragm also will be seen. So these are the three important structures related to the left side of abdominal aorta. So this is abdominal aorta, left side. First structure is left lymphatic duct, second structure is duodenojejunal flexion, and third structure is left crus of diaphragm. So these all about the relations of abdominal aorta on front, behind, and on right and left side. Now we will move on to details of how the branches are seen over here. So about the branches and their distribution we are going to see in a detail. So now we are going to see details of branches of the abdominal aorta. So we have dealt about the situation and the relation of the particular artery, that is abdominal aorta. Now we are going to deal with the branches of this major artery. So to talk about the branch of abdominal aorta, we have got the tube giving various branches from its anterior, posterior, lateral and terminal part. So those things we are going to club together to understand better about the branches of. So now we are going to arrange the branches under 4 groups. So in 4 groups we are going to arrange the branches of abdominal aorta. So among that 4 branches we have got again dividing into 4 parts. First one is ventral. Ventral in the sense anterior aspect branches, and then we have got lateral on the sides of the arterial tube, and then we have got dorsal branches, that is from behind the abdominal aorta, and then we have got terminal branches. So now in all these 4 parts we have got some branches arising from the abdominal aorta, such as we are going to see about the branches coming from ventral aspect. So from the ventral aspect we have got 3 major arteries arising, such as we have got celiac trunk or celiac artery, and then we have got superior mesenteric artery, and then we have got inferior mesenteric artery. So these are the 3 branches arising from the ventral aspect. Same way, if we have to talk about the lateral branches, laterally we have got 4 branches arising, such as we have got one for the diaphragm, that is inferior phrenic artery, and then we have got another branch for the suprarenal aspect. So middle suprarenal artery, and then we have got third branch as renal artery, which is for the kidney, and then we have got one more branch which is going to supply the gonads. So we are calling that as gonadal artery. So these are the four branches coming from the lateral aspect of abdominal aorta which we are dealing now. So ventral aspect 3 branches, lateral aspect 4 branches, and talking about the dorsal part, that is in the posterior aspect, we have got 2 important branches. One is for the 4 lumbar vertebra, that is 4 pairs of lumbar arteries. 4 pairs of lumbar arteries. Along with that, we have got below vertebra, that is sacrum. For that, we have got median sacral artery. So these are the 2 branches arising from the dorsal aspect, 3 branches from ventral, lateral 4 branches. Now the terminal aspect, that is at the end of the abdominal aorta, we have got 2 branches. One is external iliac artery and another one is internal iliac artery. So these all about the branches of abdominal aorta which we are dealing. So abdominal aorta consists of all these branches coming from each aspect of its 2 ventral, lateral, dorsal and terminal branches. Now we are going to deal details of all these ventral branches. So first we will move on to celiac artery and their description. So now we are going to see details of the ventral part branches. Among that, first artery what we have is celiac trunk. So celiac trunk is considered as the first branch coming out from abdominal aorta in the ventral aspect. So this celiac trunk again have got its own special characteristics, such as it is a short wide vessel. So if you are seeing the arterial tube of this, it is a short tube with about 1.25 centimeter. So celiac trunk, it is only about length of 1.25 centimeter and it is considered as a short wide vessel, and it is surrounded by celiac plexus. So the celiac trunk, it is surrounded by celiac plexus, which we already have seen in relation of abdominal aorta in the anterior aspect. So celiac plexus is surrounding the celiac trunk. Now we will move on to relation and then the branches of this particular artery. Whichever artery we are going to deal with special characteristic features along with the relation. So relation means what are the other structures related near to it. So talking about the relation of celiac trunk. So we have got the celiac trunk, which is a small tube. So this celiac trunk which is coming out from the abdominal aorta, consider this as abdominal aorta, and the celiac trunk is coming out as a small vessel. And this celiac trunk, it is surrounded by celiac plexus, and above the celiac trunk we have got relation of liver. So we have got the liver again with some important parts in the inferior surface, that is in the visceral surface. We have got a process of liver, that is papillary process. So in the inferior aspect we have got papillary process of the liver. So this is the liver of our body. So in liver we have got papillary process which is related just above the celiac trunk. So papillary process of liver is related above the celiac trunk, and below it we have got pancreas, and this pancreas again have got many parts. Among that, the body of pancreas with a small elevation will be seen below the celiac trunk. So this elevated part is considered as tuber omental. So this is the pancreas. So pancreas have got a part elevating towards the celiac trunk, and this process is called as tuber omental, which is related below the celiac trunk. So celiac trunk, it is related above with papillary process of liver and below with tuber omental of pancreas, that is body of the pancreas. This is again divided into 4 parts: head, neck, body and tail. In that body part have got an elevation. We will call that as tuber omental. And if we are talking about the course of this particular artery, so talking about course of the particular artery, it is a small vessel as we already know. So this vessel, it proceeds forwards. It proceeds forwards and towards right. Forwards, and then it is passing towards the right side. So this is the course of the small vessel. Now we will learn about the details of the branches of this particular artery, which is very important. So we have got 3 important branches coming out from this celiac trunk. So branches of celiac trunk we are going to see. The first artery what we have is left gastric artery, and then we have got splenic artery, and then we have got common hepatic artery. So these are the 3 important branches arising from the celiac trunk. So left gastric artery, as the name indicates, it is passing towards the left side to supply the stomach region, and then we have got splenic artery to give its major supply to spleen, and then we have got one more artery, that is common hepatic artery. Now we will see the details of each artery separately. That is, we are going to deal about the branches of celiac trunk in a detailed account. So now we are going to deal about the details of branches of celiac trunk. Before that, we will see a schematic picture of how the branches are getting distributed. So we have got our celiac trunk. So we have got our celiac trunk. So consider this as a celiac trunk coming out from the abdominal aorta at the level of T12 vertebra. And from this celiac trunk we have got first branch arising, which is going towards the left side and getting winded below. And this artery is nothing but left gastric artery. So it is going towards the left side and then towards the lesser curvature of stomach. So we are calling that as left gastric artery. And then we have got next artery, which is coming as a tortuous course from the same celiac trunk and going towards the left side, and then dividing into many branches towards the organ called spleen. And this artery, which is having a tortuous course, we will call that as splenic artery. Then again we have got another artery towards the right side, and that artery is called as common hepatic artery, which will again divide into some branches, such as we have got right gastric artery, and then we have got gastroduodenal artery, and then we have got proper hepatic artery. So we will talk about the details later. Just understand this is celiac trunk. Celiac trunk with 3 branches, and this branch is called as left gastric artery, splenic artery, and this is common hepatic artery. So these are the 3 important branches arising from the celiac trunk. About each artery we are going to detailedly see now. So first we will move on to the left gastric artery. So we are going to see about left gastric artery. Whichever artery it is, we have to deal with same few points such as the features and then where it is related and how it is coursing. Later we have to talk about their branches. So left gastric artery, it is the first branch arising from the celiac trunk, and it is the smallest branch compared to the other 2 branches. And then we have got this artery which is passing upwards and to the left. Here you can make out. So celiac trunk, from celiac trunk we have got this left gastric artery. It is arching upwards and to the left, forwards, and then it is going to pass near to the cardiac end of stomach. It is going to pass near to the cardiac end of stomach. So this is how it is going to arch. So this is how left gastric artery is arching, that is upwards, forwards towards the left side and near to the cardiac end, and then it is coming towards the lesser curvature of stomach. So this is the lesser curvature of stomach we have got. So if you imagine, we have got stomach over here. So in stomach we have got, so like this we will be having. So this is the lesser curvature of stomach. So near to the lesser curvature, the left gastric artery will be related, which is going to anastomose with right gastric artery coming from the right side. So this is how left gastric artery will be coursing. Now we have got some branches arising from this left gastric artery, such as here we have got stomach. So we know this is stomach, this is stomach, which is a continuation of esophagus. So we have got esophagus here, and for the esophagus, in the lower part of esophagus, we have got some branches arising from the left gastric artery. So those branches are short esophageal branches of left gastric artery. So these are the esophageal branches of left gastric artery. So this is how we have got branches coming out and going to supply the lower part of esophagus. So these are about the details of left gastric artery and their branches, how it is giving. Now we will move on to the next artery, which is a major artery of celiac trunk, which is tortuous in its course. We will call that as splenic artery. So talking about the splenic artery, you know it is the largest branch of celiac trunk and it is having a tortuous course, and this artery is passing towards the left side to end up in the hilum of an organ called spleen. So we have got an abdominal organ called spleen, and in that abdominal organ we have got hilum, that is the opening seen in the organ, and through that opening it is going to end up by dividing into smaller branches or small splenic branches. By that course it is going to end up in the splenic tissue. So this is the splenic artery and its tortuous course, and it is passing just above the upper border of body of the pancreas. So this is the pancreas region which you are seeing. In pancreas again we have got head, neck, body and tail. So this is the head, neck, body and tail region. Just above the upper border of body of pancreas we have got this course of splenic artery present with its smaller branches dividing into splenic tissue. Now we will get to see about the branches of this particular splenic artery. Talking about the branches. So branches of this splenic artery, we have got 4 important branches coming out from this. One is short gastric branch, short gastric branches, and then we have got some branches for the pancreas. We will call that as pancreatic branches, and then we have got another branch called left gastroepibloic artery. So this is how we have got the branches arranged. Along with that we have got some splenic branches or terminal branches ending up in spleen. So splenic branches. So this is how we have got branches coming out from splenic artery. First talking about the short gastric branches. So we have got short gastric branches arising from the upper border of the splenic artery. So the splenic artery, it is giving some branches, that is we have got our stomach over here. So somewhat imagine we have got stomach. So for stomach we have got this part as fundus of stomach. So this is fundus of stomach. For the fundus we have got some branches arising from the upper border of splenic artery, and those branches are nothing but short gastric branches. So these are the short gastric branches which is supplying the fundus of stomach. And then we have got pancreatic branches arising from the lower border of the splenic artery. So these pancreatic branches are many in number. Among that, we have got one branch which is larger and supplying the whole of the body of pancreas, and one more branch which is going specially to supply the tail of pancreas. So we have got many pancreatic branches arising from the lower border to supply all parts of pancreas. Among that, the branch which is larger to supply major part of pancreas, we are calling that as arteria pancreatica magna, because it is supplying the major part of pancreas. And then we have got one more artery which is having special name to supply the tail. We will call that as caudal pancreatic artery. Caudal pancreatic artery. And these are the two more smaller important branches arising from the pancreatic branches. One is arteria pancreatica magna and caudal pancreatic artery along with other pancreatic branches. And then we have got left gastroepibloic artery which is arising from the upper border of splenic artery to supply the greater curvature. So in the lesser curvature we have seen one artery, that is left gastric artery, which is going to supply near to the lesser curvature and get anastomosed with the right gastric artery coming from the other side. And here from splenic artery we have got one branch which is going to pass near to the greater curvature. So near to the greater curvature it is going to have its course like this, which is getting anastomosed in the remaining part with the right gastroepibloic artery which is coming from the other side, that is a branch of common hepatic artery. So this is left gastroepibloic artery which is going to anastomose with right gastroepibloic artery coming from the other side near to the greater curvature. So this is how we have got branches coming out from splenic artery. Among that we have got one more branch, that is splenic branches, which is the terminal branches of the splenic artery entering the hilum of spleen and dividing into many divisions to supply the spleen tissue. Whole of the spleen is supplied with the splenic branches which is going to pass through leno-renal ligament which is seen near to the hilum of spleen. So this is how we have got whole of the splenic arteries distribution and their branches coming out. Now we will get to see the third branch of celiac trunk, that is common hepatic artery, in detail. So now we are going to see about the details of common hepatic artery, which is the third branch of celiac trunk. So we are getting to see the whole explanation or detailed account of celiac trunk. So in that we have finished two arteries such as left gastric artery and splenic artery. Now we are moving on to common hepatic artery. As the name itself it indicates, it is going to supply major part of hepatic region, that is liver region, and how it is getting distributed we are going to see now. So we have got celiac trunk, and then we have got two arteries, left gastric and splenic artery. Along with that, on right side we have got one artery, that is this common hepatic artery. So right side the one artery which we have is common hepatic artery. The left side two arteries are left gastric artery and splenic artery. So about this common hepatic artery we are going to see in detail. This common hepatic artery, it is passing forwards and towards the right, and then it is going to reach near to the upper border of body and head of the pancreas. Near to the junction of head, neck and body, we have got this common hepatic artery dividing into two branches. So we have got pancreas, we have got neck here, head here and body over here, and this is the tail of pancreas. Now reaching near to the neck and body of the pancreas, we have got this common hepatic artery dividing into two branches. So we have got one branch, that is right gastric artery. So we have got one branch, that is right gastric artery as a first branch, and another branch we will call that as gastroduodenal artery. So we have got gastroduodenal artery and right gastric artery as two branches coming from the common hepatic artery. and one more branch which is going towards the upper side, that is continuation of this common hepatic artery, is proper hepatic artery. I will explain again. This is common hepatic artery which is going towards the right side, and then it is reaching the junction between neck and body of pancreas and dividing into two branches, and the trunk itself, it is going to continue as one branch. So we have got three branches coming out from common hepatic artery. So this is common hepatic artery. This is right gastric artery. We know left gastric artery coming from the trunk of celiac trunk, and this is gastroduodenal artery. And then we have got one trunk which is going towards the liver upwards, and this artery is called as proper hepatic artery. So these are the three branches arising from common hepatic artery. So now we will deal with all these three arteries separately. Talking about right gastric artery, it is the first branch arising from common hepatic, and it is passing downwards, and then it is winding towards the left side. So from right side it is arching towards the left side to anastomose with this left gastric artery. So we have got left gastric artery which is coming from celiac trunk is going to get anastomose with the right gastric artery which is coming from the common hepatic artery. So this anastomosis is going to happen in the lesser curvature of stomach. So we have got stomach, we have got lesser curvature. So consider we have got stomach with greater and lesser curvature. So here in the lesser curvature we have got this. So this is the duodenal part. I have got duodenum over here. So likewise we will be having. So we have got stomach over here. This is lesser curvature and this is considered as greater curvature. In the lesser curvature we have got anastomosis between left gastric and right gastric artery. Now we have got gastroduodenal artery, and this gastroduodenal artery, it is going to reach between the duodenum and head of the pancreas, and again it will divide into two more branches. So I will show you here. So we have got pancreas, and then we have got duodenum, so this is the duodenal part. So between the duodenum and the pancreas, head of pancreas, at this junction it is dividing into two branches. So gastroduodenal artery we are dealing now. This is going to divide into two branches. So these two branches are nothing but we have got right gastroepiploic artery, gastroepiploic artery, which is going to supply the greater curvature and getting anastomosed with left gastroepiploic artery, which is a branch of splenic artery. And then we have got one more branch, that is pancreatico-duodenal artery. So this pancreatico-duodenal artery, it is present, we can make out this is present between the duodenum and pancreas, and it is present in the superior part of the pancreas. So we can call that as superior pancreatico-duodenal artery, which is going to anastomose with below part, that is inferior pancreatico-duodenal artery. So this will be inferior pancreatico-duodenal artery, which is a branch coming from superior mesenteric artery. So we have got this gastroduodenal artery dividing into two branches, superior and gastroepiploic artery, and this gastroepiploic artery arching towards the left side to anastomose with the left gastroepiploic artery. So left gastroepiploic artery, which is a branch of splenic artery. And then we have got the another artery which is coming from the common hepatic, is a continuation of common hepatic, which is arching towards the right side towards the liver of the body. So we have got liver present over here. So in the liver we have got a opening, and that part we will call as porta hepatis. So this region is called as porta hepatis. Near to the porta hepatis, this proper hepatic artery, is going to divide into two branches. So that is left branch and right branch of the proper hepatic artery. So this proper hepatic artery will again divide into right and left branch, and this is going to enter inside the liver to supply the musculature or supply the tissue of liver present over there. And this right hepatic artery or right proper hepatic artery, which is giving another branch for the gallbladder, we will call that as cystic artery. So we have got cystic artery, which is a branch coming from right branch of proper hepatic artery. So this is how we have got branches coming out from common hepatic artery. So this is common hepatic artery, which is dividing into three branches: right gastric, gastroduodenal artery. So this is first branch, gastroduodenal second branch, and third branch is proper hepatic. Right gastric anastomosing with left gastric near to the lesser curvature of stomach. And gastroduodenal, it is dividing into two branches, gastroepiploic and superior pancreaticoduodenal. Right gastroepiploic anastomosis with left gastroepiploic, which is coming from the splenic artery. And then superior pancreaticoduodenal anastomosis with inferior pancreaticoduodenal, which is a branch of superior mesenteric artery. Then we have got proper hepatic, which is arching towards the right side. Near to the porta hepatis, it is dividing into two branches, right and left branch. In that right branch, it is giving another branch for the gallbladder. We will call that as cystic branch. So these are the distribution of common hepatic artery we have to see. Now we will move on to the another trunk which is coming from abdominal aorta, that is superior mesenteric artery. So next artery we are going to deal with the superior mesenteric artery. So this is the second branch coming from the ventral aspect of celiac trunk at the level of L1. So we have got celiac trunk and superior mesenteric artery with inferior mesenteric artery coming from the ventral part. So we have got this as abdominal aorta. So from the abdominal aorta, at the level of T12 we have got celiac trunk, L1 we have got superior mesenteric artery, and at the level of L3 we have got inferior mesenteric artery. Among that, now we are going to deal with superior mesenteric artery, how it is arching and what are the branches coming out from it. So to talk about superior mesenteric artery, it is arising at the level of L1. After arising, it is having a course which is having its concavity towards the right side and convexity towards the left side. So consider this as right and left. So we have got right side and left side, and this is how superior mesenteric artery will be seen. And this superior mesenteric artery have got a concavity towards the right side and convexity towards the left side. Now we will move on to the branches, how it is distributed. So this superior mesenteric artery, from its convexity, it is giving some 12 to 15 branches. So we have got many branches arising from the left side like this. So those branches are called as small intestine branches. That is, we have got for duodenum, we have got some separate branches arising from celiac trunk and also from the superior mesenteric artery. But for jejunum and ileum, we have got these all branches arising from the convexity of the superior mesenteric artery. So these straight vessels which are going to supply whole of the jejunum and ileum, which is 12 to 15 in number. So these arteries are called as jejunal and ileal branches. Jejunal and ileal branches. So these are the branches which is coming out from the superior mesenteric artery from its convexity, that is from its left side, to supply the jejunum and ileum part. So now we will move on to the other branches which is arching or coming out from the right side part of superior mesenteric artery. So we have got superior mesenteric artery. As you already know, we have got concavity towards the right side, convexity towards the left side. From the concavity, we have got 4 important branches arising. So we already dealt with this left side branch. Right side branch we are going to concentrate. On the right side, we have got first branch which is arising as inferior pancreatico-duodenal artery. So we have seen superior pancreatico-duodenal, which is coming from the gastroduodenal artery, which is getting anastomosed with inferior pancreatico-duodenal, and this artery is called as inferior pancreatico-duodenal artery, which is anastomosing with superior pancreatico-duodenal, which is a branch coming from gastroduodenal artery. So this is superior pancreatico-duodenal artery. And the next branch which is coming out is right. We have got, this is right side, and here we have got colon which is present over here. So we will be having distribution of colon over here. Just imagine we have got colon which is having cecum, and then we have got ascending colon, and then we have got transverse, and then we have got descending with sigmoid colon. So we have got somewhat this type of distribution of colon. So this is cecum, ascending colon, transverse colon, descending colon, and sigmoid colon, which is going to end up in a rectum. So now we have got the superior mesenteric artery. This superior mesenteric artery, first branch from right side is inferior pancreatico-duodenal, and the second branch arising is middle colic artery. So we have got middle colic artery which is going to give 2 more branches. So we have got again 2 more branches, such as we have got right and left branch. So like this we have got some branches arising. So like this we have got branch arising as the second branch of superior mesenteric. So first branch is inferior pancreatico-duodenal for the pancreas and duodenum, and the second branch is for colon. We have got middle colic artery. So this artery is nothing but middle colic artery. And this middle colic artery is dividing into right and left branch. You know, this is right side and this is left side. It is dividing into right branch and left branch. And then the third artery arising is, this is middle colic, and the third artery is right colic artery. So we have got right colic artery which is coming towards the colon and dividing again into 2 branches above and below. And this branch is called as ascending and descending branch. A branch which is going above to anastomose with the right branch of middle colic artery. We will call this branch as ascending branch. And the other one which is going below is descending branch. So this artery is called as right colic artery. So this is right colic artery which is dividing into ascending and descending branch. And again we have got one more artery, that is ileocolic artery, that is going to supply cecum. You know, we have got one more part which is ending up here, and that is nothing but ileum. Ileum will be seen over here, and here we will be having appendix somewhere here. So we have got ileocolic artery which is going to supply ileum along with the colon. So that is again dividing into ascending and descending branch, where descending branch again have got some 3 more branches. At last it is going to end up with joining with the superior mesenteric artery trunk. So likewise it is going to end up. So this is how it is going to end up, by anastomosing with the ileocolic artery. So superior mesenteric artery, right side branch we are dealing. Inferior pancreatico-duodenal which is going to supply the pancreas and duodenum. Then we have got middle colic which is again dividing into right and left branch. So this is right branch and this is left branch. And then we have got right colic artery which is going above and below as ascending and descending branch. And this artery is called as ileocolic artery. Ileocolic artery which is again dividing into ascending and descending branch, and one more branch it is going to join with the trunk of superior mesenteric artery itself. So here this right branch of middle colic artery anastomoses with ascending branch of right colic artery, and descending branch of right colic anastomoses with ascending branch of ileocolic artery, and descending branch of ileocolic anastomosing with the main superior mesenteric trunk. Meanwhile, it is giving three more branches. Those are nothing but cecal branches and appendicular branches. We have got these three branches as anterior cecal branch, posterior cecal branch, and appendicular branch. So these are the branches coming from the right side of the superior mesenteric artery. So we have dealt with the right side branches of superior mesenteric artery coming from the concavity, and we are going to deal with the next artery now. Before that, I will just summarize. This whole trunk is called as superior mesenteric, which is coming from the level of L1 from abdominal aorta ventral aspect, and this is the convexity towards the left side, which is giving only jejunal and ileal branches, and from the concavity we have got four branches: inferior pancreaticoduodenal, middle colic, right colic, and ileocolic, and it is giving some branches right and left, ascending descending branches to anastomose with itself. Now we will move on to the another artery, major trunk arising from the abdominal aorta, that is inferior mesenteric artery. Mesentery in the sense it is present in the peritoneal fold of small intestine, which is called as mesentery. So we are calling that as superior and inferior mesenteric artery according to their position. This picture we will keep for further use. Now we will move on to inferior mesenteric artery now. So we are going to deal about inferior mesenteric artery. So inferior mesenteric artery. So we are going to deal about inferior mesenteric artery. So as you know, we have got some certain levels for all these arteries to arise. Inferior mesenteric artery, it is arising from the level of L3, and after arising it is going to have its course. So inferior mesenteric artery, it is arising from the level of L3, and then it is going to give branches from its left side. So from the left side it is giving branches of 2 in number. One is for the colon, that is we have dealt with middle and right colic artery in the superior mesenteric artery. So in this image you can see we have seen middle and right colic artery, and this inferior mesenteric artery, it will be arising somewhere from here. So this is inferior mesenteric artery. It is giving branch from the left side, that is we have got left colic artery. So we have got left colic artery again dividing into ascending and descending branches. So we have got left colic artery. So here also I will show you. So we have got left colic artery which is dividing into ascending and descending branches. So this is left colic artery which is dividing into ascending and descending branch. So this ascending branch, it is anastomosing with left branch of middle colic artery. So left branch of middle colic artery as anastomosing with ascending branch of left colic, which is coming from inferior mesenteric artery. And then we have got other branches such as sigmoid branches, which is again 2 to 3 in number, which is again having ascending and descending branches. So likewise we have got many sigmoid branches. So we will be having many sigmoid branches arising, and among that we will be having this inferior mesenteric artery. I will show you in this. So inferior mesenteric artery, after giving left colic, it is giving many ascending and descending branches of sigmoid artery. Sigmoid artery which will be 2 to 3 in number. which is again giving ascending and descending branch. And this inferior mesenteric artery itself, it is going to continue as superior rectal artery, which is again divides into two. So this is superior rectal artery, which is dividing into right and left branch. And this superior rectal artery, it will give some branches to anastomose with sigmoid branch. So these two are sigmoid branches. So left colic artery and these two are considered as sigmoid branch. And this sigmoid branch, it is again giving ascending and descending branch. So ascending, descending, again ascending, descending branch. And at last the sigmoid artery itself, it is anastomosing with superior rectal artery, which is a continuation of or terminal branch of terminal part or continuation of inferior mesenteric artery. This inferior mesenteric artery, again it will anastomose with the internal iliac artery branches, that is we have got middle and inferior rectal artery. So we have got middle and inferior rectal artery for the rectum. So we have got middle rectal artery and inferior rectal artery, which are branches of internal iliac artery. Internal iliac artery. So this is how we have got branches coming out from inferior mesenteric artery. So this is the way how the branches are distributed. Here I will show you again in this picture. This is colon and this is how branches are arising. Now you can make out we have got a pattern like this. So arteries, it is having a pattern in an archwise. So along that we have got arteries arranged. So we have got this type of arrangement, and this arterial arrangement is called as marginal artery of Drummond. Marginal artery of Drummond is the arrangement of the anastomosis of all these arteries. So all these arteries are getting anastomosed in an arch-like pattern. We will call that as marginal artery of Drummond. And one more clinical significance what we have is sometimes the anastomosis between the middle colic and the left colic will not happen. So this is the connection between superior and inferior mesenteric artery. So this anastomosis, if it doesn't happen, so we have got this anastomosis, if it doesn't happen, what will happen is we will be having some major artery, that is from superior and inferior mesenteric. So from superior and inferior mesenteric, we will be having direct arterial connection, an arterial tube connecting the superior, and anterior tube which is coming out from inferior mesenteric directly will get connected, and this arches or this anastomotic channel is called as arc of Riolan. Sometimes if this anastomosis doesn't happen, this condition will arise where an arterial tube arises from superior, an arterial tube arises from inferior, will anastomose with each other to form an arc. We will call that as arc of Riolan. And one more thing is, if in case we will be having this anastomosis, if does not happen, that is the branch of sigmoid artery and the branch of superior rectal, if doesn't happens, we will be having discontinuation at this place. We will call that as critical point of Sudeck. Critical point of Sudeck. It is a condition happens if this anastomosis does